All righty. Well, thank you for joining me on this Saturday, and Happy New Year, everyone. Hope everyone's having a nice 2021 so far. And so, speaking of 2021, I put together this presentation and I actually first broadcast it on Facebook yesterday, and then I figured I would do the same on Zoom and live stream it to YouTube rather than Facebook, since I streamed it to two of my pages, two pages yesterday, and then my Facebook group. But I know, of course, not everybody is on Facebook, which is why I'm doing this encore presentation here. And then usually yesterday it lasted about a half hour, so about 30 minutes it lasted. And then I answered questions. So I will do the same thing here. And let me just make sure I'm pretty sure everything's good to go on YouTube. Yep, I think we're good. So hopefully we're good on YouTube. So actually, let me. So I need to bring up. It's been a while since I live streamed to YouTube, just because I know there might be questions on YouTube as well. So let me just see if I could bring up the live stream on YouTube, the chat on there. Let's see. Let's see. Sorry about that. Like I said, I've been streaming to Facebook, not YouTube. All right. I might not. I'll tell you what. Let me just go ahead and do the presentation. Then I'll worry about questions later, comments later. So. All right. So again, 10 tips to make 2021 your healthiest year ever. And not a surprise, or it shouldn't be a surprise. We're going to start with eating whole healthy foods. So hopefully everybody watching this is eating a healthy diet. And of course, a lot of people, even if you weren't eating healthy in December and maybe even Thanksgiving time, a lot of people start eating better comes in the new year. So as far as eating whole healthy foods, of course, you want to eat plenty of vegetables. Variety is important. So not just the quantity, the servings of vegetables, but trying to get some good variety. Cooked versus raw veggies. So I personally do both. If you have problems tolerating raw vegetables, then of course, eat them cooked. But I am a smoothie person, so I have a few veggies each day in my usually like 4 to 7 cups of veggies in my smoothie per day. And then when I eat meals, definitely for dinner, a few servings of veggies. And lunch, a lot of times I make a pretty big smoothie. So sometimes I'll have my smoothie for lunch, which was actually the case today. I had it for breakfast and had it for lunch. Organic is, of course, preferred. And then so AIP versus paleo. So for those with Graves or Hashimoto's or the antibodies to both, I commonly recommend autoimmune paleo as a starting point. Now, there's no single diet that fits everyone perfectly. So this is my starting point, and I will modify the starting point for some people. So if someone's a vegan, vegetarian, a strict autoimmune paleo diet is pretty strict. And so for those who are not familiar, I'm sure a number of you, such as Thomas, who I know Thomas, you joined us on our the last challenge. So I'm sure you're very familiar with AIP, and I'm sure others are as well. But if you're not, it's similar to paleo or regular paleo. If you eat meat, you could eat meat, fish, vegetables, fruit, eggs, nuts, seeds. Of course, you're going to be avoiding refined foods and sugars and fast food and unhealthy oils. So with AIP, it's a little bit similar to paleo, except you're avoiding eggs, you're avoiding nightshades, tomatoes, eggplant, white potatoes, peppers, and you're avoiding nuts and seeds. And again, it's not meant to be a long-term diet, just a starting point. And as I mentioned, for some people, we do make modifications. So again, that's the big difference: eggs, nuts, seeds, not just tomatoes. Tomatoes, it's they're part of the nightshade family, but again, I mentioned eggplant, peppers, as well as white potatoes. Dark chocolate, a question mark here. Unfortunately, dark chocolate, if you're following strict autoimmune paleo, you're supposed to avoid dark chocolate. Now, there'll be some people that still eat a little tiny square of, let's say like 80% dark chocolate per day. And many people will still do okay, but if you're really trying to follow strict autoimmune paleo diet, you'll also want to avoid the dark chocolate. Coffee, same thing. There are some people that just can't give up their coffee or won't give up their coffee. If you're following strict AIP, then ideally you should at least initially give up coffee. Again, we're not talking about permanent changes here. And if you eat meat, you want to eat grass. Like if you eat beef, for example, grass-fed beef, pasture-raised poultry, wild fish. All right, so let's move on to tip number 2. Always work hard on, always work on stress handling. So block out at least 5 minutes per day and then gradually increase. And again, do this every day. Ideally, of course, it would be great if you're blocking out 10, 15, 20 minutes, 30 minutes per day. That would be amazing. But start with 5 minutes, because again, the key is to do it every day. And if there are a lot of people doing, a lot of people don't do anything for stress management, but those who do block out time for stress management, a lot of those people are doing things 2 or 3 times a week. They might be doing yoga 3 times per week, let's say, but you really want to do something daily. Again, doesn't mean that you have to do 30 minutes per day every day. And that's why I'm bringing up 5 minutes per day and then gradually increase. So again, some examples: yoga, meditation, biofeedback, and definitely don't sweat the small stuff, which I think most of us have a tendency to do, including myself at times. Get a massage at least once per month. So this is, I brought this up yesterday because when I first brought this up, I'm like, yeah, that's one thing I'm not doing. And then I remembered I actually am getting a massage. It's just not a relaxation. It's more of a therapeutic. I was diagnosed with thoracic outlet syndrome in September. And so I've been seeing a massage therapist. At that time, I was seeing massage therapists at first like twice a week and then down to once a week. And now it's every 3 weeks. So it is once a month, but again, I can't say relaxation massage. So I definitely need to do that. Tip number 3, always work on reducing your toxic load. So again, from a dietary standpoint, you want to eat mostly organic foods, become an expert in reading ingredients, drink purified water. And so you might see me sipping on my reverse osmosis water here. I also drink spring water out of a glass bottle, Mountain Valley Springs. So if you're concerned about reverse osmosis removing all the minerals, of course you could add minerals, or you could drink spring water out of, again, preferably not out of a plastic bottle, but out of a glass bottle. Also, there are other good filters like Berkey filter, which doesn't remove all the minerals. All right, and then filter the water you bathe in. Ideally, you want to do that. Either get a couple of shower filters, or you could go all out and get a whole house filter. As far as reducing toxic load, try to use mostly natural cleaners and cosmetics, at least most of the time. If every now and then you use, regular cleaners, that's not a big deal. But if you're just like, if you like me and spraying the countertops, we have, 3 cats, 2 dogs, and, the cats are all over the countertops and all that. So commonly cleaning countertops, well, not, I won't say constantly, but a few times a day. But we have some natural cleaners. And, we also have a few air purifiers. So I'm in my home office right now, we have 3 air purifiers, 3 blue air purification systems. And then at my actual office, which I have not been spending too much time, I've been just like a lot of people, home a lot, but we do have a air purification system there. And then consider infrared sauna therapy. So this is something I do not only recommend, but I personally do at least a couple of times per week. And then also next time you buy a mattress, so I bring this up, not just the mattress, but just really your bedroom. Most people will spend anywhere from a quarter to hopefully a third of your life is what you're spending. 6 hours would be a quarter, but hopefully you're spending closer to 8 hours in your bedroom trying to get good quality sleep. And so, if you have just a regular mattress, we did for years, no worries. But if you're in the market for a new mattress, maybe think about buying a natural mattress or organic mattress. We have an avocado mattress. We've had that for a few years. Naturepedic is another good brand, and they actually have more certifications. Last I checked, they have a lot more certifications than pretty much I think any mattress out there. Is your home in a toxic location? Again, maybe you might not be able to do much as far as moving, but something to consider, I guess, if you live on, like if your house is on a busy road or especially like near a highway, for example, then, I mean, again, you might not be in a position to move, but definitely get that air purifier, like maybe multiple air purifiers. And another big reason to do sauna therapy. And again, try not to jog or ride your bike on a major road due to, again, like breathing in the exhaust, or at least don't do it in the middle of the day, maybe early in the morning, depending on where you live. If you're, being that it's winter, that might not be a good option either. But again, all these things, you want to do as much as you can. If the goal is not to make you paranoid about toxins, but some people, some people have the option. They could just maybe go to a greenway and jog or ride their bike. It just might be convenient to just start, do it around your home. But if it's on a major road, you might actually be doing more harm than good. All right, so tip number 4, do everything you can to improve the health of your gut microbiome. So again, you could do this through probiotic foods as well as supplements, prebiotic foods and supplements. So a number of years ago, it wasn't too long ago, I think it was 2018, I attended an online either 4 or 6 week online course from Dr. Jason Horlick, who's a probiotic expert, and you can learn more about him by visiting the website probioticadvisor.com. And so he was talking a lot about variety and eating 40 plus different whole plant foods each week. So again, I can't say I eat that many foods, but yeah, I would at least strive to eat 15 to 20 different foods per week. I mean, start with 5 to 10 if you're not even doing that. But yeah, 40 is asking a lot, because again, he's not saying servings of like 40 servings, but 40 different types. Minimize the use of gut disrupting drugs such as antibiotics, proton pump inhibitors. Minimize use of antibacterial soaps and hand sanitizers. Minimize exposure to glyphosates, which is an active ingredient in the herbicide Roundup. Limit the use of natural antimicrobials, because even natural antimicrobials like oregano oil, berberine, and those are things I've used, on myself and on patients. I'm not saying there's definitely a time and place, but some people will think, oh, these are natural, so they're not going to have any negative effect on my gut health, and that's definitely not the case. All right, so tip number 5, get sufficient sleep. So definitely want to start with the basics, try to go to bed at a reasonable time, eat a healthy diet overall, especially reduce your consumption of sugar. You might need to test adrenals and correct any imbalances. So if someone has problems either falling asleep or especially waking up in the middle of the night and then having problems falling asleep, adrenals aren't the only potential cause, but it could be a big factor. So you might want to consider testing adrenals. Practice mind-body medicine. I mean, you could do it any time of day. Some people prefer doing it in the morning, but if you're having issues with sleep, you might want to, even if it's 5-10 minutes before going to bed, but maybe longer, maybe work up to, again, 15, 20, 25, 30 minutes even, and see if that helps. Maybe take a hot bath. I can't say I take a hot bath before going to bed, but that's an option to consider. Use essential oils such as lavender. Again, improve your bedroom environment. So, I mean, make sure the room is completely dark. If you have electronics in your room, unplug them. You know, if you're don't sleep with your cell phone right next to you, but if you do, put it on airplane mode. And you know, minimize use of electronics before going to bed, like an hour before going to bed, maybe shut everything off. Unplug the Wi-Fi, which actually I think actually there's another slide on electronic pollution, so I'll wait until we get to there. But should you take supplements and herbs? I mean, there is a time and place. I can't say I never recommend supplements, herbs for sleep, but again, you want to do as much as you can, diet and lifestyle, because even if you take supplements, it should be temporary. If someone like takes melatonin, for example, which of course is common, you don't want to rely on melatonin permanently. And speaking of melatonin, a lot of people take okay, sorry. Yeah, this is recording. Just making sure. If not, it's live streaming to YouTube, which that automatically records. But you know, if you take a melatonin, a lot of people start with like 3 to 5 milligrams before going to bed. But I would usually recommend starting with 1 milligram or even half a milligram. And there actually is a company, Pure Encapsulations, which unfortunately they have been bought out by Nestle. That happened a couple of years ago, and you know the ingredients still look the same. I can't say I never recommend their supplements still, but they have. I realized just I think it was just a few months ago that they have a melatonin supplement that's half a milligram, 0.5 milligrams. All right, so we're halfway done. So tip number 6: take care of your oral health. All right, so you want to see a biological dentist, ideally. I know not everybody could do that, but, and I don't think I listed the website. So website, IAOMT, International Academy of Oral Medicine and Toxicology, if you want to search for a biological dentist. Of course, the basics, brush and floss daily. I recommend using a fluoride-free toothpaste. And then also something that I've been doing that some of you, I'm sure, are familiar with, but oil pulling. And if you're not familiar with oil pulling, again, I'm sure many of you are, but if not, I've written a blog post on this, so you could visit my website, naturalendocrinesolutions.com, and just do a search for oil pulling. And should you remove mercury amalgams? So in a perfect world, yes, eventually. I won't say that you necessarily need to do that to get into remission, but from an overall health perspective, it's a good idea. And again, to reduce your toxic load. Root canal is more controversial. So again, I've had mercury amalgams in the past. I've had root canal in the past. I'm glad currently I could say that I don't have any silver fillings. I don't have any root canals. But I can't say that they were really causing issues. Like I did have some, like I did find out I'm allergic to nickel. Like I did have a nickel crown, and I was having some bleeding. But the mercury amalgams, root canals, I don't know if they were really causing problems. But again, so again, I don't want to say that you need to rush to a biological dentist and get mercury amalgams, root canals removed. But if someone's not progressing, I mean, I think that should be a goal maybe in the future if you can't do it now. But if you're not progressing, if you're doing things naturally, let's say following the advice of what I'm giving here, things are not improving, maybe something to consider, if you're, or maybe doing more of working with, natural healthcare practitioner, and just things don't seem to be improving. Maybe it's not mercury amalgams or root canals, but again, if you've been doing a lot of other things, I guess the point is don't neglect your oral health. All right, so tip number 7, reduce electronic pollution. So again, especially focus on your bedroom, unplug all electronic devices before going to bed. So I mentioned that before. Try not to carry your cell phone with you everywhere, especially in the house. And if you do, like I actually do have my cell phone here. I usually keep it with me in case if I have to, well, it depends on the situation with here. If I'm looking something up, or again, testing. If something doesn't work with the computer, I have to test on my cell phone, but it is on airplane mode. So you shouldn't hear it ring at all, or it's usually on airplane, not airplane mode. It's when it's not on airplane mode, usually on any vibration anyway. So, but anyway, don't be, I would say try not to carry it every single, I mean, a lot of time, most of the time, you know, if I'm this, you know, most of the time my cell phone is not with me. It's in another room, just because, again, I'm not one that, when someone calls, I pretty much let it go to voicemail. So I'm not one where every time it rings, I pick up. Most of the calls I get, I don't even know who they are, like numbers I'm not familiar with. So I just let it go to voicemail. And I use my computer more than my cell phone as far as like searching the internet. So really, a lot of times it's just, you know, I'm just somewhere where I'm not. Unplug Wi-Fi at night. So again, this is something I do. I've been doing this for a few years now. Actually, my older daughter usually does it because she goes to sleep a little bit later than I do. So she unplugs the Wi-Fi. You could also use a timer. So that one of these days I'll get a timer, but for now we just unplug it. Maybe consider getting rid or turn off your smart meter. So after I was diagnosed with Lyme in 2018, I went ahead and got this done, got it turned off. So if you want to learn more about electronic pollution, a good resource, electricsense.com. And then some of you might be familiar with Dr. Joseph Mercola at mercola.com. He has a great book on EMFs that came out last year in 2020. So you could find this on Amazon. EMFs, 5G, Wi-Fi, and cell phones, hidden harms, and how to protect yourself. All right, so tip number 8, exercise regularly and be active. All right, so how frequently should you exercise? How intense should you exercise? All right, so I mean, exercise frequency, I mean, I would say at least 3 days a week. I mean, if you want to do it more than that, like 4 or 5 days per week, I mean, you want to be active every day. But as far as actually, like when since with everything that happened last year, we have some home equipment now for upper body, like a rowing machine and a bench with some weights. Also have a rebounder. Have had a treadmill desk for a while, with the treadmill, of course. But I still go to the gym. I only go to the gym now once a week for lower body, and that I might stop just because, just really a big reason is, I mentioned this yesterday too, just the spraying of the chemicals everywhere, when going to the gym. So I might, just still go just because I can't get as good of a upper body workout at home. But anyway, intense, you want to be careful, especially if first of all, if you have problems with adrenals, which a lot of people have, you don't want to overtrain. And then in addition, if you have adrenal issues, which a lot of people do, you want to be cautious as well. So on a wellness basis, I'm a big advocate of high intensity interval training, but while restoring your health, you do want to be cautious. And again, if you have hyperthyroidism, you want to be, I'm not saying not to do aerobic exercise, just want to be careful. Same thing again, weak adrenals, and I mentioned high intensity interval training. So weight bearing exercise, I think, is important to do, especially if you have hyperthyroidism or hypothyroidism. But hyperthyroidism, typically you'll get low bone density, low muscle mass. Now, of course, that's due to the elevated thyroid hormone levels. So weight-bearing exercise isn't going to be the necessarily long-term solution, but I mean, overall, it's good to do it. I mean, my hyperthyroidism has been under control for 10 plus years, and I do weight-bearing exercise. So again, I do recommend it for everyone, really, regardless. Again, regular movement is important, and of course, a lot of us are sitting here due to this presentation, but hopefully that's not your regular routine. Take frequent breaks, get a standing desk, or again, I have a treadmill desk, but a standing desk is also good, less expensive. Well, I mean, the one I have, I forget the name of the treadmill desk. It was like $400 or $500. It's a pretty big desk, but there are less expensive ones, or again, you could get a standing desk. All right, so tip number 9, keep your vitamin D levels above 50 nanograms per milliliter. So if you're not in the United States, or maybe even the United States, most labs in the United States use nanograms per milliliter, and some will say that 60 to 80 is even better, but at least 50. If you're, again, in Europe or somewhere else, the lab might use nanomoles per liter, and so I would recommend use so 50 nanograms per milliliter, as you can see here, is equivalent to 125 nanomoles per liter. So vitamin D is important for immune system health and has anti-inflammatory effects. Vitamin D deficiency can make you more susceptible to developing autoimmunity. And so I recommend, if you test for it, which I would recommend at least once per year, but if you're deficient, you're going to probably want to supplement with vitamin D and then do a test after a few months. But 25 hydroxy vitamin D is what I recommend. Some people do the 125 hydroxy, and I have a video on that also, where I explain the difference between the two, but it's the 25 OH or 25 hydroxy that you want. And again, I test my levels once a year typically, but if you're deficient in vitamin D, then you're going to want to, of course, try to get more sunlight, but you're probably going to need to supplement, and then maybe like 2 to 4 months later, retest. Again, sunlight versus supplementation. So I do supplement just because I do get some sunlight, but not enough. And, it's also not just the amount of sunlight, but if there's a lot of air pollution, that could block the UV light. And, some people, there's genetics where it makes it more difficult for them to absorb vitamin D. And then as far as dosage of vitamin D, assuming you need to take vitamin D3, it really depends. I take 5,000 IUs per day just because, again, whenever I test, that's what I've been taking for a few years now, and my levels are typically in the upper 50s, lower 60s. So that's so that's telling me that I need that amount to maintain that level. Now, perhaps if I continue to make a greater effort to get more sunlight, maybe I won't need to. Maybe I could reduce that a little bit. But really, you gotta start with a certain dosage. I mean, if someone's really deficient, I might put them on 10,000 IUs for a month or two, and then I'll typically have them reduce that. And again, just have them test and then see what the test shows, and really just try to get to a maintenance dose based on the testing. And some people will ask, well, can I just maintain it through sunlight alone? And some people can, some people can't. So again, that's something you will need to experiment with. If you have healthy vitamin D levels, you could certainly try to get some. I mean, it depends also where you live. If you're in Florida, it might not be a problem year round getting enough sun, but if you're up north, that might be an issue. You might have to supplement during the winter months, let's say, and then try to get as much sun as you can during spring and summer. And always want to take vitamin K2 with D3. K2 helps to guide calcium into the bone. Vitamin D3 helps with the intestinal absorption of calcium. So K2 is important because if you don't, pretty much a few years ago, the research showed that calcium could increase the risk of cardiovascular disease, calcium supplementation. And the problem is when you don't have enough K2, it could, and there's really not a good test for testing for vitamin K2. The good news, you can't really overdose. I mean, you could probably overdose with anything, but research shows you really would need to take probably and even like real massive doses don't show anything bad. But that being said, of course, I'm not recommending massive doses of vitamin K2, but just make sure if you take D3 or calcium, to take vitamin K2. All right, so final tip, keep a gratitude journal. Write down at least three things you're grateful for. Do this. I would recommend doing it every night and then just reviewing the journal in the morning. So a couple of things, I don't have three things I listed here, but one is I'm grateful, of course, for the opportunity to share this information with you and answer questions, which I'll be doing in a couple of minutes. And then grateful that my wife and 2 daughters are happy and healthy. So feel free to share what you're grateful for. All right, so that is pretty much it. So yeah, so it was, I guess, about 25 minutes, which I said it'd be like 25, 30 minutes. So go ahead. If you have questions on Zoom or let me figure out YouTube. Oh, actually, there we go. Okay, so I got YouTube chat here. So if you're on Zoom, just go ahead. There's a little chat box. Just go ahead. If you have questions, definitely ask. And again, if you're on YouTube, you can also use the chat there. And pretty much I will go back and forth depending on how many questions. We'll see. So yesterday with when I did this on Facebook, there was a good amount of questions, but then again, I was also streaming to two of my pages and one of my group. And I mean, I'm two of my pages and I only have one group right now. So, all right. So let's see, YouTube, there is nothing here. All right, well, if there are questions, like I said, let me know. All right, here we go. So sometimes we need that very first question to get rolling. So I have graves, but once I take methimazole after 2 to 4 weeks, my T3 and T4, T3, T4, and TSH becomes normal. If I continue to take it soon after 2 weeks, I become hypo quickly. So I have to stop the medicine. After 4 months of taking the medicine, I'm taking 5 milligrams maintenance dosage. Any suggestions or thoughts? So, all right. Yeah, so pretty much it's so you're taking 5 milligrams maintenance, and I'm guessing that's not making you hypo then. It's just when you're taking the higher dose of methimazole. I mean, I guess a few things. So one, I mean, this applies for both grades and Hashimoto's, but you know, of course, you want to try to address the cause of the problem and not just, you know, so like when I dealt with Graves, I was diagnosed with Graves 2008. And so I didn't take methimazole. I took bugleweed, which is an herb with anti-thyroid properties. And, you know, so it was later, like fall 2008, when I started taking a natural approach. So went into 2009. And pretty much I have not taken bugleweed since 2009. So if I didn't do anything to address the cause of the problem, who knows, maybe I'd still be taking bugleweed, or maybe, I mean, who knows what would have happened. I mean, again, that was 10 plus years ago. Like most people on this call with hyperthyroidism, the goal, you know, I wanted to do everything I can to avoid radioactive iodine, thyroid surgery. But yeah, so if you're, you know, 5 milligrams, I mean, it's a low dose. And there are some people that just are on 5 milligrams, or some people would take half a tablet, like 2.5 milligrams for maintenance. But as you, I'm sure you know, it's not the methimazole. It's sometimes necessary. You know, even though I didn't take methimazole, a lot of my patients do take anti-thyroid medication as long as they're doing fine and, you know, symptom-wise doing okay, and not, you know, not having like elevated liver enzymes or white blood cell count depressed, which sometimes happen. Yeah, anyway, so I'm fine with them taking it. So I'm not saying to, you know, that it's not a good idea to take medication, but it's not a long-term solution. Again, some people will take it as a long-term solution to kind of keep their numbers in check, but really you want to try to do things to address the cause of the problem. And yeah, so that yeah, so anyway, I would say, I mean, so again, there is bugleweed, you know, so, you know, you could always try out the bugleweed, but that's not the solution either, you know, so really just try to, you know, definitely, I mean, follow the tips I gave here, try to make as many changes as you can from a diet and lifestyle standpoint, and do things to find, remove triggers. You know, I commonly recommend adrenal testing, you know, certain blood tests. I mentioned vitamin D, you know, but you know, there's other blood tests as well, but you know, vitamin D is important for a healthy immune system. I like hair mineral analysis testing, even though it's definitely not a perfect test. And I don't rely on that for, you know, just that for minerals. I do look at some of the markers in the blood too. But point is, you need to find, remove triggers, correct underlying imbalances such as nutrient deficiencies, and then hopefully you will get to the point where you don't need to take the meds. Again, the good news is you're on a low dose, 5 milligrams, but ideally the goal would be to get to the point where you don't need to take any medication. So, all right. So Lisa, unfortunately, scheduling conflict and missed a portion. Will there be a replay? Yeah, it's being recorded on Zoom, and it's live streaming to YouTube. And for those on YouTube, I do see your questions in the chat, so I will I will get to your questions as well. Actually, what I'll do is after finishing this, and I know Shar, I see your question in Zoom, but I'll get to a few YouTube, since they I know Shelly's had her question there for a little bit. And yeah, so but yeah, definitely this is going to be recorded, so I will send an email with the recording. And or you can also visit my website, I'm sorry, my YouTube channel, Natural Thyroid Doctor, and that should be available relatively. I know Facebook, it's available pretty much right after the live stream. YouTube, sometimes there is a delay. Sometimes it's a few hours later, but all right. So Shelly, what is the worst heart complication you've seen with Graves? I mean, I guess in some cases maybe arrhythmias. I mean, yeah. I mean, I can't say like it's where I've seen like extensive heart damage. I mean, or over the years, some patients and number of patients had arrhythmias before, like they even like the key is to try to you need to be safe while managing the symptoms. That's why also I'm not saying, for anybody not to take any medication, or even sometimes beta blockers are necessary to take. So, a concern, which is more than just heart complications, but thyroid storm, which again, if you're not, if you're, the big concern is uncontrolled hyperthyroidism. And some people, I think, take it lightly when they have a resting heart rate in triple digits. So there's, atrial fibrillation, arrhythmias, also, let's not forget just the heart, but it could have elevated thyroid hormone levels, could have a negative effect on bone density. So again, everything's risk versus benefits. And some people, sometimes they get criticism, like, why am I even trying to do things naturally, because they're concerned about the risks. And there is when I was dealing with Graves, there was that concern too. But I took the bugleweed and I took motherwort. If those didn't work, I would have taken a medication. So I wasn't. I mean, there's some people that are just they, no matter what, they don't want to take the medication, which I understand. But again, there is a time and place for that. So. All right, so Claudia, I'll answer Claudia's question here, then I'll go back to Zoom and Charles, then I'll answer your question. So Claudia, hi, Dr. O, Happy New Year. Happy New Year to you as well. So it's been 4 months since I stopped anti-thyroid treatment for Graves. How long do I have to wait until I know whether I relapse or go into remission? Well, so I guess one thing I would say, or one thing I'll ask, besides, I'm sure your thyroid hormone levels look good, your thyroid panel, hopefully everything looked good, TSH, free T3, free T4, but hopefully they also looked at antibodies, because some endocrinologists won't look at antibodies, but hopefully, like, if your antibodies were not tested, then you don't know really for sure if you're in remission. If your thyroid panel is looking good, antibodies are normal. It's hard to say. Some people will relapse after like a few weeks or a month or two off of the medication, and then there are some people, like, for 6 to 12 months that everything will be going fine, and then all of a sudden they'll start slipping again. So they'll start feeling hyper, usually is what happened, because they might, after like 6 months, they might be like, oh yeah, no, I feel pretty good, everything's okay, and they're not doing regular tests, but then they'll start feeling a little bit hyper and do a blood test, and sure enough, they're hyper again. So yes, all looks good. TPO antibodies are high. So yeah, so TPO, a thyroid peroxidase antibodies, those are auto antibodies. So again, you really ideally would want those to be normal before concluding that you're in remission. Remember what Graves, there's thyroid stimulating immunoglobulins. Those are the ones that are specific for Graves. So TPO antibodies are very common with Graves too, but we see them in most people with Hashimoto's. But the thyroid stimulating immunoglobulins, or TSH receptor antibodies, those are more specific for Graves. But just if you just mentioned TPO antibodies are high, so that alone is saying that you still have that autoimmune response. So again, that's the challenge when someone is just taking the medication. So doctors might say, well, take the medication, and then and maybe they'll take the medications for like 18 months to 2 years. And if everything looks good, they'll wean them off the medication, and then they'll say, let's hope you're in remission. But a lot of times they won't look at the antibodies. Again, Graves is immune system condition more so than a thyroid condition. So you really want those antibodies to be normal, which again is not it takes time. It is challenging, but that's really the goal as far as trying to get into remission. All right, so Char asks, and this is again, I'm back in Zoom. How do you figure out underlying causes for Graves? So what I do and what I did when I was dealing with Graves, so like a health history. So my patients will fill out a health history, and a big thing is testing. Again, it doesn't mean someone has to spend a lot of money on testing. I'm actually conservative with, but it depends on the case. If someone needs testing, I'll recommend it. I'm not going to, like recommend testing that I don't think is necessary. But if I think someone needs more comprehensive testing, I'll let them know. And then if they can't afford it, then, just we could, try to prioritize. But I'm more conservative. So usually I do recommend adrenal testing, like either adrenal saliva testing or dried urine testing. Again, I mentioned hair mineral analysis to look at some of the minerals and heavy metals, blood testing, and sometimes I'll do a comprehensive stool panel or organic acids testing. But again, not on everybody. But it's just, so I am a big believer in testing to look for triggers and underlying imbalances. And again, you could also, I'll also add, try to do as much as you can diet and lifestyle. Like if food is a trigger, you might be able to figure that out just by cleaning up your diet, just following the recommendations I gave during this presentation here. But again, so sometimes even if people have food triggers, it's common to have multiple triggers. But again, it does make sense to try to make those changes first. And one thing I should say, I wasn't going to make the announcement, but since I'm kind of talking about it here, for those with hyperthyroidism, Graves' disease, again, it's not official, but in all likelihood, I think probably like 90% chance that the first week of February, I'm going to do a free 5-day hyperthyroid challenge. I'm probably focusing on the diet. So definitely be on the lookout for that. I'll be, of course, sending emails just to let people know. And again, it's free. So and it's, I'm going to be pre-recorded lessons. I'm going to be doing some of these calls kind of like I'm doing here. But again, the lessons will actually be pre-recorded. So it really doesn't matter where you're going to be. And some of the live calls, I'm going to rotate. Like I'm not going to just do day calls, but I'll rotate those calls. All right. So Linda, I asked previously how to avoid reduced thyroid nodules, and you said to read your article on your website, which I think said you were going to update it. Any timetable for the update? Any advice suggestions? Was borderline hyperthyroid, but after eliminating gluten and switching to organic plant-based diet, all thyroid markers are normal. TSH, free and reverse T3, and antibodies and immunoglobulins are all normal. Maybe stress from COVID and other life circumstances. Yeah, so I don't remember saying I'm going to update it, but I could. What I could do now, I could just quickly put in the chat. Let's see. I could find that because there is one that's relatively updated. Natural endocrine solutions. Let's see. Yeah, so this one, I mean, it's from January. Actually, it's 3 years old now, but it's still pretty relevant. So I'm going to put that in the chat. And I did write one last year on toxic multinodule goiter, which doesn't sound like you have, but I could also put that in because some of the information is still relevant for, that was last May, so relevant for someone with nodules, but even if you don't have toxic multinodule goiter. So I'll put that in the chat too. But if you look at the article, like if you look at the blog post, you'll see, that so insulin resistance, estrogen metabolism are two big factors. And, sometimes iodine too, the controversial iodine deficiency. Oh, actually, let me get back. Now I lost YouTube. Oh, there we go. Yeah, so definitely check that out. And just a sec. Okay. Yeah, so definitely check that out. But again, problems with insulin resistance is big. So if you have blood sugar imbalances, especially hyperglycemia, insulin resistance, that's a factor. And then number two, which I won't say priority, but estrogen metabolism, that sometimes can be the main factor. Problems with estrogen metabolism, and that's the only test I know of that looks at estrogen metabolism is the Dutch test with dried urine testing, has markers for estrogen metabolism. And you could always just do things to support estrogen metabolism, such as eat plenty of broccoli and broccoli sprouts, or take what's called DIM or diindolylmethane. But yeah, like I said, that blog post is yeah, I try when it comes, like, again, so it's 3 years old, but like I said, I wrote last year so every year, like I don't want to write the same, especially I don't want to write the same articles all the time, especially if little has changed. And honestly, wouldn't be a whole lot, so again, I don't remember saying that I'm going to update. Maybe I did, or maybe I was ready to come out with that toxic multinodule goiter article, but yeah. So all right, anyway, if there are any other questions, definitely let me know here. Okay, so Linda says no insulin resistance. So yeah, so maybe more problems with estrogen metabolism. Again, possibly iodine deficiency, which is definitely more controversial, and recommend if someone does test for iodine, I recommend urinary iodine testing. But again, I'm very cautious what testing and supplementation for iodine. I personally had a real good experience with iodine in the past, like iodine supplementation, but unfortunately that's not the case with everyone. So I don't recommend for everyone to test and to supplement with iodine. So, all right. So if there are any other questions, let me know. If not, I mean, it was planning to stay till at least 4 o'clock, like make it a full hour, depending on the questions. But if there are, okay, here we go. So Shelly, my goiter goes up and down. Is that indicative to anything? I mean, so goiter, I also wrote, I can write it. So, I mean, I wouldn't say it's indicative of anything necessary. I mean, It could be like thyroid hormones. So I'm just also finding the article on, again, the toxic multinodular goiter. You might want to check that out, but there's another article that I'm looking for too. But so if you have, so having hyper or hypothyroidism is a factor when it comes to some goiters. That's only one potential factor. And if you're, let me just, oh, actually you're on YouTube. Can I put that in YouTube? Okay. I was going to put it in the chat, but uh-oh. Uh-oh, I think something went wrong with with YouTube. So Shelly, I don't know if you could still hear me. That's a bummer. Oh boy. Hopefully it still recorded the presentation on YouTube. I mean, I assume it did, but something happened here. So yeah. Anyway, so Shelly, I don't know if you can hear me, but goiter, I was going to say thyroid hormone imbalance could be a factor when it comes to, like, if you have hyperthyroidism or hypothyroidism, and the fluctuation of thyroid hormones could be a factor. Sometimes the same thing that causes nodules, like problems with estrogen metabolism, insulin resistance, could also affect the goiter. But definitely, like when I was dealing with hyperthyroidism, I had a mild goiter. And so, you know, if it is fluctuating, it could be due to fluctuations, like if you're taking medication or even something like bugleweed. Okay, you're here. Can you hear me too? You said you're here, but can you hear me? Can you also hear me, Shelly? Because it's showing on my end that YouTube, maybe if I refresh YouTube here, maybe it's just, let's see what happens when I refresh here. Okay, yeah, I think maybe I am still live here. All right, so maybe I just need to do more live streaming to YouTube. So, okay, so Shelly can hear me. Okay. So, all right. So anyway, so that's what I would say with the goiter. I was gonna, again, I think what happened, I was trying to put a link into the YouTube chat, like I did with Zoom, and I think maybe I clicked something, and then it was saying I got some type of error message on YouTube saying this. Yeah, but I just refreshed it and looks good. All right. Anything else? Any other questions on either Zoom or YouTube? All right. If not, I'll call it a day. Last Saturday, so June 2nd, the day after the New Year, I actually did a Facebook Live. I did a Facebook Live. I actually like a lot doing Zoom. It's just Facebook Live. It's a little bit easier. Don't have to like send everybody the links with Facebook Live. I just have a program called StreamYard, and I just create the presentation, and then it pretty much lets everybody know who's on the Facebook platforms. I mean, not everybody gets notifications, I'm sure, but that's the same when I send an email. But anyway, so I did a Facebook Live. I mentioned I did one yesterday. I did one last Saturday too, and it was crazy busy. So just wasn't able to answer all the questions. So here, so I don't know if it's just because it's the second Saturday, not the first Saturday, or again, just yeah. Anyway, but if there's no other questions, I will go ahead and call it a day. And just for those who did ask questions, or for those who just hung out and listened to other people's questions, thank you for attending. And again, I'll try to do more of these. Just it really depends on the demand, and like meaning next one might actually be one specifically focusing on hyperthyroidism. So we'll see how that does. It also, I know this was more of a general topic, not thyroid related 10 tips, which I'm sure there's a lot of those going around in the healthcare field, just related to beginning of 2021. But again, the next one I'll probably be doing like a hyperthyroid chat, and so we'll see what turnouts on that. But again, just thank you for attending. Hope everyone has a wonderful day, and look forward to seeing you in a future call. All right, take care, everyone.